focused on exciting projects that the American Pharmacists Association Foundation is working on. My name is Nancy Lyons, and I'm Vice President, Chief Pharmacy Officer for HealthMart. It is my absolute pleasure to introduce all of you to Ben Blummel with the APhA Foundation. Ben is Executive Director and Senior Vice President for Research and Innovation at the American Pharmacists Association Foundation. With over 29 years of experience in developing patient care programs and 12 years in pharmacy practice, he collaborates with various stakeholders, including HealthMart, to design and implement innovative patient-centered care systems. Ben is passionate about improving healthcare delivery by focusing on patient empowerment, collaboration, safety, outcomes, and cost reduction. He earned his pharmacy degree from the University of Missouri, Kansas City School of Pharmacy. Please join me in welcoming Ben to the stage.
Thank you, Nancy. Okay, so the technology is working, which is always a good prerequisite. I'm really glad to be here this morning. Glad you chose to stop by. My plan is to talk for about 10 minutes or so about our projects and leave some time for questions so you can be thinking about them as I'm talking. So let me jump. Well, here's our disclaimer. And here we go with slide number 1. So I'm going to talk about 3 or 4 different projects that HealthMart Atlas pharmacists have been involved in over the course of the last couple of years and give you a view of what's coming down the pike. So most of our projects that we implement at the APhA Foundation are some combination of a unique technology innovation and an optimized process of patient-centered team-based care. And so in this first one that I want to talk about, Project Impact Cardiovascular Health, we have 40 pharmacies in 20 different states, not by accident. They're the 20 states that comprise 2 of the Medicare Administrative Contractor regions in the country, where they're delivering care by using this new technology from a company called AliveCor. And I happen to bring along a visual aid. I don't know if anybody's seen this device before. It's called an AliveCor CardioMobile 6-lead. And so the pharmacist has the patient go through a process where essentially they do a stroke risk assessment, and then they do an EKG, because you can get a 6-lead EKG from this device in 30 seconds. And so it's medical grade, and it puts them in a good position to identify the majority of people who are walking around out there with AFib or other abnormal rhythms, and they don't even know it. Get them referred to their primary care physician or their cardiologist, and get them diagnosed and treated and back into the pharmacy for an ongoing care management program. But one of the other really exciting things about this initiative, along with another initiative that I don't have on the slide today, because we're actually just concluding the phase of that initiative, is a program in continuous glucose monitoring. In particular, improving access for patients to CGM devices in a couple dozen pharmacies in a variety of geographies across the country. But in both of these projects, we're doing something very innovative. So we heard Rohit talk about the future of pharmacy. Well, at the APhA Foundation, we've been trying to invent that preferred future through a variety of these different kinds of initiatives. So in these 2 projects, imagine if pharmacists were credentialed just like their physician colleagues. And what if we paid them for the same CPT codes for their patient-centered team-based care services? What could happen? What will happen? And this is how we're inventing that preferred future for all of us in taking it to the next level of patient care. So another one of the projects that we've got in the field right now is a project called Project Impact HPV Immunizations. And this initiative is a team-based care project where pharmacists are identifying patients who are eligible to receive HPV and basically focusing on the cancer prevention opportunity that exists there and making sure that those people get initiated on their 2 or 3 dose series, whatever's indicated for them, and making sure that they get those particular vaccines. So that's an exciting initiative, and we have a new wave or a new phase of that project that's going to start here in a couple of months. So keep it in mind and stay in good touch with the team at McKesson because there'll be a notice that'll go out as soon as that phase 2 starts recruiting, as soon as we get through all of our IRB approvals. So that's on deck next. And then another project that we implemented last year and is complete, and we're hoping will be sponsored. We've got a proposal in process, is a test and treat initiative, where we had about 30 pharmacies that participated in that initiative and added that new team-based care service to their bevy of things. And in each of our projects, we're committed to pharmacists actually being paid fairly for the services that they're delivering and demonstrating the clinical, economic, and humanistic outcomes that can be had if you get the pharmacist well integrated into the team. So now I'm going to talk about another initiative that's here and now. Okay, you can sign up for it. You can go over to the McKesson booth. I've got some handouts here that you can grab that'll help you to be able to sign up for it. But just imagine for a moment if you could be paid as a provider of Medicare Diabetes Prevention Program services by CMS, and we didn't have to change any legislation or regulations to do it. Well, that's the opportunity that exists in this particular project. So the APhA Foundation is in the majority of Medicare administrative contractor regions today. And so if you express interest, there's a QR code on the form that you can pick up or that you can pick up over in the McKesson booth. And ultimately, basically, you can sign up and become a subsidiary with the APhA Foundation. And we have a turnkey process where for each patient that you enroll in one of your cohorts in these group classes, as long as you or one of your pharmacy technicians has been trained in a CDC-recognized lifestyle coach training program, you can deliver these services. We have a medical claims processor that we work with at the APhA Foundation. All of that stuff is handled in the back office for you. And so all you have to do is worry about inviting people in your community to participate in diabetes prevention, which is a target-rich opportunity. Right now, if you think about it globally, actually there's 828 million people on planet Earth with diabetes. There are more than twice as many people who have prediabetes. And all of those people have an opportunity to receive these services. But in particular, if you're a Medicare patient, this is a structured benefit for you. And you can actually receive these services for free in these community pharmacies. The other great benefit to this is that if you want to basically forge this path on your own, you can do that too. It'll require you to go through a process with the CDC of becoming recognized, which will take 18 to 24 months. And you can go through that process and you can set up your own implementation of the diabetes prevention program. But if you sign up through our umbrella hub organization, essentially you immediately become a subsidiary with full recognition, and you can deliver this care and be paid for it right away. So we think that this is a great opportunity. If you get 2 or 3 cohorts with 15 to 20 people enrolled in them, you can easily pay for a full-time technician. But that full-time technician probably won't be kept completely busy delivering those services. So there are a lot of opportunities for growth in your practices and ways that you can actually enhance the quality of care that's being delivered, and you can be paid fairly for those services. So we're super excited to offer this to any of the pharmacies who are interested or who express interest, and look forward to talking with you more about it or hearing from people here at the meeting. And so this slide, I'd like to focus on our credentialing process. So in the CGM project and the cardiovascular health project that I talked about earlier, initially we had pharmacists who went through the process of becoming credentialed, just like their physician colleagues, with an organization called CAQH. And that was successful, but arduous and difficult. And so we looked for a new way to build the solution. And so there's an organization which you may or may not be aware of called Pharmacy Profiles. The other side of the page that I have for you has information about that. But if you go to pharmacyprofiles.com, you can sign up for a free pharmacy profile. And if you populate that profile, you'll actually have entered more information than CAQH requires to actually accredit physicians with health plans to actually be paid by those health plans for their services. And so right now, Pharmacy Profiles is just completing an arrangement where essentially they'll be teaming up with CAQH to be able to have a data share. So your process as a pharmacist will be super simple in a place that's really familiar to you by just completing your own pharmacy profile with your own secure information at APHA. And then ultimately, once you've done that, at least in those two projects that I was referring to, we have a very simple process where then you sign up with our Impact Care Transformation Network as your third step on the slide. And ultimately, then you're able to be involved in these different types of initiatives where health plans are covering this patient-centered team-based care that you as pharmacists are delivering. So it's super exciting and a super easy way to basically take a few steps and innovate in your practice to actually be paid for the care that you're delivering, the services that you're providing. And right now, today, you can do it for your Medicare patients with diabetes prevention programs. Everybody's got an opportunity to sign up for that. And then we have 3 or 4 new projects that'll be starting here in the next few months that we'll be announcing through our HealthMart Atlas partnership with McKesson. And your pharmacies will have an opportunity to be involved in those particular initiatives. So at any rate, that's the short story in 12 minutes or less. And so I'm happy to talk more about any of the work that we've got going on at the foundation or things that we've got in the hopper and things that you might be interested in your community pharmacy practices that we can be supportive with you about. So
we're going to start Q&A, and I wanted to just reinforce a couple of the messages that Ben just shared. All of you who are HealthMart Atlas members, some of that contracting is already handled. There's already a contract in place with APhA Foundation for HealthMart Atlas members that smooths part of that step that Ben just talked about. Still needs to go through the vetting process to make sure that the individual is ready to go. But lots of details about that at Dolly's Pharmacy. Please go down and check that out. What questions do you all have?
It's so good to see you. I am so excited as a longtime foundation donor to see this opportunity, and I still practice pharmacy, and there's such a great need. Is the immediate opportunity doing the group classes? Can you clarify that a little bit here with this? Okay, great.
Yeah, the immediate opportunity is in the diabetes prevention program space. And ultimately, we've got all kinds of resources and customizable materials when you sign up for this that you can put your logo on and you can promote the availability of this Medicare diabetes prevention program service in your practice. And basically, people can sign up for it. And once they do, we've got a turnkey system that basically you send them to the site. Participants sign up for different classes that you have scheduled, different cohorts, and ultimately, as you deliver those classes, those data go into our system and automatically get processed through our claims processor with Medicare. And then those payments actually come back, and we direct deposit those funds for the Medicare payments into your account through the APhA Foundation. And that's the reason why this works, because the APhA Foundation is one of 14 or 15 organizations in the entire country that the CDC has designated as an umbrella hub organization. And so what that means is that we can sign up with Medicare as a supplier to actually have our subsidiaries, aka all of your pharmacies, participate in the program. And ultimately, then you don't have to go through the red tape of actually spending a year, 12 to 18 months delivering diabetes prevention program services, submitting your data to the CDC, having them review it, and actually get approved by the CDC, which are all of the prerequisites and steps that are normally required for you to be able to be paid for your DPP services. So when you sign up as an umbrella hub with us in this program, basically day one, you're ready to go. And so you start a cohort a couple or 3 weeks out from there. Any of those participants in that cohort, ultimately you can receive payment for. So hopefully that helps to make this here and now opportunity really great. And basically, right now, today, as I'm standing here, 8 of the 12 MAC regions we've got coverage in. So that covers about 2/3 of the country. And if you're in a place where you really want to do this, and we've got an opportunity to partner with you, we'll fill in with the rest of the country, and our intention is to do that by year end. So it'll be, anywhere in the entire U.S. Any other questions here this morning?
It looks like we have lots of note takers. Can I pass out the handouts that you've been talking about?
There you go. So on one side of this handout is information about the Umbrella Hub, and there's a QR code there that you could go to and sign and get information and express interest there. You can also meet up with the McKesson team over in Molly's Pharmacy, Dolly's Pharmacy. It's Nashville. And ultimately go beyond dispensing in your practice and deliver patient care and be paid for it. So that's the offer, that's the opportunity. Really glad you chose to spend some time with us here today, and happy, yeah. McKesson will have them at the Health Mart Atlas booth.
Yeah, please go back and check. And Ben, I just wanted to thank you for sharing the time
Of course.
with us today,
Yeah,
talking about
happy
the
to be
exciting
here.
opportunity, both for APhA Foundation partnership and the relationship that we have with Pharmacy Profiles. We're going to make practice different.